Unfortunately, we are going to see more death cases. The number of Ebola victims are on the rise, and this is as a result of two preventable factors. The first is ignorance and denial, and the second is the fear factor. Let's look at denial. Why don't people believe that Ebola is real? Or why don't people believe that Ebola is here, despite the massive number of people that are dying?
The government officials themselves say it was just a design or strategy for government to raise money. That is those that have degrees, not the native. What do you expect? They will say it's false. There is no Ebola.
Now, I can tell you that some people still do not believe that there is Ebola. Because the way the government handled the issue from the beginning. So it makes the people now, they not believe that the sickness is existing.
Look at where it means that yesterday somebody was sent to shoe factory, we may ambulance take the person and carry the person here to the hospital. Then they brought that person back in the community. They say they play foot. Then they fight Ebola.
Our unit here, which is actually run by the Ministry of Health and supported by WHO, it has capacity for about 35 beds. But they have over 45 patients and have to turn down patients on a daily basis because of the number of cases that we are seeing.
The problem about Ebola has gone beyond the government. So the citizen itself have to work hard in order to fight against Ebola and succeed. But if we wait for the government, then it's like we perish.
So we will see a situation in which we lose more people due to malaria and other preventable diseases like typhoid or cholera because of the fear of Ebola. So it's a major problem for the health system. It has caused many health systems to literally collapse, including JFK, which was closed for a while in order to decontaminate the place after we had an exposure of Ebola virus. Other hospitals, I recently was told that 3 midwives were infected at Redemption Hospital, causing that hospital again to close. We are struggling after we lost our colleagues. And as a matter of fact, as I said, we were not closed because of fear of Ebola. We closed in order to fumigate, clean up the place, and get it ready again.
Well, if you were in their shoes, you would do the same thing, at least not after losing so many people. Now that the hospitals are open, why are people not still going to the hospital? This is where the fear factor plays a very significant role.
Because they feel that if they go to the facility, they will be isolated. And definitely because of that, they prefer to buy drugs on the side.
If I say I'll not be go to the hospital, because when you go to the hospital, they will say they will not be test you. First of all, they will think that Ebola. You really get running stomach, they will say that Ebola. But between those, they will really have they come on running stomach and chloride and But this time, when it happening to you, they will say that Ebola.
All those signs are being possessed by Ebola. Malaria have the same sign, diarrhea have the same sign. So when you go to the hospital, they will decide whether that diarrhea, what caused the diarrhea, what caused the vomit. They will check all the names that people can consider you to be Ebola patient.
People are afraid because of this thing that the Ministry of Health have put in the back of the health workers, that anyone you see, take them that they are suspected Ebola patient. So many people are a little bit afraid. When you talk to them, they say, "Mama, I don't want to go to no hospital."
Now people are very scared of going to the isolation center because the rumor says that when you get there, you are being sprayed. And after being sprayed, you die. So people are afraid of going or people are afraid of turning over themselves.
Not really. I don't believe that I will come down with Ebola personally now, because since then, Ebola break out in the country, I haven't seen one single patient. I gave you a story that I used to ride someone that they say came down with Ebola, and 8 person died in the house. Up to this time, I'm still alive and things still moving fine for me. So I don't believe that.
A lot of Liberians are in the denial stage. We don't believe, or most of us don't believe that Ebola is real. you talk to people in the market, it's like Ebola is not real. Why can't I see someone who died from Ebola? We need to see someone from the hospital. We need to see what's going on there.
Ebola is in the country. How can we be convinced that Ebola is in the country to see the body, how the body looking? And people can allow you to see the body and we look at the thing that we post, look at the body, we'll look at the body, how the body will look like.
So for Liberians, most Liberians, they want to see. In Liberia, seeing is believing.
Even the Marcella here, you know we can convince me if the body that I saw in the show, if you can go to the center and take a photo and bring it showing the community that this is thing that can happen. At the end of the day, you come in that this is thing that can happen. You will be convinced.
One of the things I think we need to do is we need to get some of the journalists to do a video documentary or some video recording with the permission of the hospital, maybe the permission of some of the Ebola patients. So the journalists will go in there and see and be able to videotape with the permission of the hospital that they can use those videos maybe in different communities so people will see, maybe put someone in
a survivor of this Ebola. Before, when they were not victims, there were deniers in them. But when they came, they are more preaching to others, even the pastors.
I think this would be very, very useful. In Guinea, what they've done, they have this footage on the same board screen in strategic places where people can actually view, local people can view. I think that would be very, very effective. Like we said, not everybody listens to the radio or television, but this screen, if put in areas where there's a huge population, like in marketplaces and other centers, it will be very effective. I will recommend it very highly.
Well, for me, this is very simple, and I will recommend this.
Naho lemio na dendulani ando nansengu ha nancha konenda ni landindini because me ana chomda peya voma naho ono na kiwa ndio na telenda kiondo.
What you just saw is a mobile cinema, or maybe that's what I call it, and it's simply a projector mounted on a pickup with short films less than 15 minutes in length. Now you move this pickup from one location to another, showing these movies, and of course with a new kind of message, which is
Ebola can be defeated. Ebola can be defeated if we act very early on. That's a positive message. And also we have seen survival cases, even in these units. In fact, in our unit, at JFK unit here, I think 35 people have been treated and released who were initially positive and are now negative for the virus. And also at the ELWA unit 2 weeks ago, they were telling us that about 45 people in 1 month were treated and released. So this is a very important good news. It's just that the news is not getting out there.
because I have been to the hospitals myself. They are all empty because people are still afraid of going to the hospital. But if only they can understand that submitting themselves for early treatment will improve their chances of survival. And of course, I think they will. You know, it's not what the rumors say. Then they begin to submit themselves to the hospital rather than going to new environment and infecting more people.